I want to start again my presentation with acknowledgement of the country, and I wish to acknowledge the people of the nations, the traditional lands, as Adrian mentioned, on which we are gathered today. I pay my respect to their elders, past, present, and emerging. Learning, teaching, and knowledge sharing has happened on this land since time immemorial. It's an honor and a privilege to be part of that tradition today. Good afternoon, everyone, and thank you so much for this opportunity. It's a real pleasure to be here with you today, both with those joining us in person and those joining remotely. I'm very grateful for the chance to share this work with you. And I would like to acknowledge that an earlier version of this work was presented at the Responsible Innovation in the Global South Ring Workshop in November 2025 in Kuala Lumpur, Monash University Malaysian campus. And I am grateful for the support of organizers, Professor Adrian Carter, the PI of the project, and the feedback received there. As the title suggests, this is a broad topic about the challenge of responsible research and innovation in low and middle-income countries. Today, however, I would like to focus on one key ethical dimension, the social value of research. I will briefly discuss what social value means, why it matters, and how it should be considered, particularly when research and innovation takes place in collaboration with low and middle-income countries. Although I will use some examples related to neurotechnology, much of the discussion is also relevant to other fields of emerging technologies research, and more broadly to many forms of North-South research collaborations. This work is also informed by my previous research as an academic bioethicist and by my practical experience across both low and middle-income countries and high-income settings, including my work as a member of research ethics committees in different capacities and different levels, from WHO Research Ethics Committee to National Research Ethics Committee, Regional Research Ethics Committee of West Pacific, Regional Office of WHO, and also in my involvement in bioethics governance. I highlighted one specific paper we recently published on ethical challenges in conducting research in low and middle-income countries in the domain of the COVID-19 pandemic. Generally, low and middle-income countries are facing structural vulnerabilities that can shape their capacity to participate in research, benefit from research, and govern research and innovation. This is a general fact. And these countries are home to around 80% of the world's population, which remained unchanged for decades. That specific part of the picture, as you can see. However, classifying countries solely by income level suffers from major limitations, as it masks deep differences in governance, inequality, health system strength, political context, and may obscure within country disparities. For example, around 10 of high-income countries have democracy indexes under 6, which means they have mostly authoritarian political systems. From an ethical standpoint, the unreflected use of income classifications can reinforce divisions that extend the legacies of racism, imperialism, colonialism, and can contribute to broader pattern of othering, and may end in oversimplification and essentialism. So we need to be very mindful when we do this kind of comparison between high-income and low-income countries. The risk of essentialism extends to economic and political essentialism, which ignores economic diversity among low and middle-income countries, and cultural essentialism, which overlooks cultural plurality at the global scale and increasing cultural diversity within low and middle-income countries, and fosters misunderstandings about what people in given country want, how they think, and how they make decisions. In case of epistemic injustice, this concept is mainly related to the fact that good research is implicitly associated with rich countries that causes a kind of testimonial injustice. As the credibility of scholars from low and middle income countries is unfairly downgraded solely because of their location rather than their quality of their work. So classifying countries only by income level can miss the increasing cultural heterogeneity at the local level and some degrees of cultural homogenization at the global level. Keeping these facts in mind, I can start with saying that while LMICs are highly diverse in their economic status, being classified as a low or middle income country generally has significant implications for research and innovation capacity. There is a major gap in biomedical research capacity compared with low and middle income countries. And high income countries, for example, have around twice as many researchers per million inhabitants as the box 2 here shows, the middle box. And the gap even more serious in health research investments. High-income countries allocate about 12 times a higher share of GDP to health research. It means that the current gap could be even more wider in future. With this, I can say LMICs generally have limitations in their capacity for conducting local research, not only international research. They have limited and unsustainable financial resources for conducting research. They have limited investment in technical and human infrastructures. They have limited scale-up and commercialization capacity that constrains the translation to production and clinical use. They have more unfair power dynamics and hierarchical structures within the research groups, which creates vulnerability for early career or less empowered researchers. There is a lack of insurance companies, specifically research insurance companies, who are capable of supporting, for example, neurotechnology trials, either because of limited financial capacity or insufficient expertise of insurers for assessing the risk of those trials, because usually insurance companies need to assess the risk of each trial. And for example, assessing the risk of implantable neurological devices and neurotechnological devices is extremely high tech, and they don't have such capacity. So this is one important issue. And even if some investigators want to do something in this area, they won't receive the research insurance mechanisms to cover their liability in case of any kind of damage to the participants. In LMICs, we have in many LMICs, we have weak civil society structures and underdeveloped science journalism that further undermines this ethical environment for emerging technologies. And finally, they have difficulties in adopting international ethics standards. Low and middle income countries' capacity for international research is also limited because they have limited expertise for ethical review of high-tech proposals. Imagine a low-income country in sub-Saharan Africa receive a proposal for a local ethics committee approval about a new vaccine technology or new implantable neurotechnological device. So the capacity for reviewing those specific, is one important limitation. Usually there's a lack of a specific national ethics guidelines, for example, for post-trial access to care for implantable neurodevices. It's a paper that recently led by our team here at Monash Bioethics Centre, I had a very small contribution to that work. But this is something completely new for many low and middle income countries. With regulatory and health technology assessment mechanisms for national regulatory agencies to secure social benefits at the time of market authorization, because usually market authorization is given by a national, for example, TGA in Australia, FDA in the United States, but national regulatory agencies in many low and middle income countries don't have enough, capacity to evaluate, for example, something like social value of a specific device. And insufficient expertise in intellectual property and patent law, data sovereignty weakness, which makes LMICs more vulnerable to data colonialism, unlimited access to scientific output in case of non-open access publications, and finally, political sensitivities and skepticism toward international collaborations that shapes the landscape of research and innovation, which is the case in many low and middle income countries. But social value of research for low and middle income countries will be made focus in the next part of my today presentation, because I see this as the main challenge for contribution, ethical contribution, and responsible contribution to international research from the LMIC perspective. Here I'm citing a very important paper from 2000. It means that by the end of 20th century, in their highly influential papers, so far received more than 1,700 citations, Zick, Emanuel, Van Dorn, and Grady identified social scientific value as the first ethical requirement for clinical research. They used a methodology, they gathered and analyzed around 12 international and national research ethics guidelines for the clinical research ethics guidelines, including Nuremberg Code, Declaration of Helsinki, Belmont Report, and all of them. And they synthesized these 7 requirements. According to this view, research can only be justified if it has the potential to generate knowledge and leads to a net improvement in health or well-being. This requirement is justified by 2 main ethical concerns: the responsible use of limited resources and the avoidance of exploitation. Although the authors recognize that different studies may have vary in their relative value, depending on factors such as the health improvements it may generate, the extent to which findings can be disseminated, and the feasibility of implementation, which is very important in this context, the concept of social value was not fully developed at that time and operationalized at that early framework. One important reminder is we should be mindful not to conflate the 2 different concepts, social value and respect for local values or the values of societies. These are different topics. We should be mindful not to conflate these concepts or use either of them inaccurately. Today, we talk about social value of research, which is generating knowledge that can lead to a net improvement in health or improvement for that specific society. Now, I can expand more on the meaning and on the concept of scientific value and social value of research. Scientific value refers to a kind of general benefit of producing generalizable knowledge relative to the state of scientific understanding that the research generates. Ethical research must have a net scientific value that you can see highlighted in the green circle in the middle of the board map that I created for this presentation. It's a ChatGPT created, picture with my,
clever prompts.
Yeah, very careful prompts. So but I can, again, I can declare that selected countries are included for illustrations and no data behind. So negative results can also contribute to generating net scientific values. Unlike scientific value, which could ideally be assessed in a global sense as the science is a global phenomenon, social value is more closely related to the context, to the benefit burden balance in each society that invests in the research, for example, through participation in clinical trials, financial or human resources. If we simply consider national borders as a way to distinguish the value of multinational or international research for different societies that contribute to it, we can imagine that even if a study generates net scientific value overall, which is reasonably assessed in a global sense, the net social value could still be different for each participating society. As you can see here, some countries have a positive net social value in green, some of them has less. So according to the picture, you can look at the different possibilities. Therefore, conducting clinical research generally requires a positive benefit burden balance, a green one, in each of the participating societies. This figure illustrates ethically acceptable, non-exploitative, multi-country research. I say generally because there could be other possibilities that I don't want to explore here. For example, we can imagine a high-income country just donates or invests in a research that doesn't directly benefit the high-income country. But for the low and middle-income country, it must be something like this. Every participating society should have some, positive benefit burden balance. But it's not easy. LMICs, everyone has challenging assessing the social value of research. LMICs in particular face important challenges in assessing the social value of research. A level of uncertainty about, firstly, the level of uncertainty about the impact of potential research is expected in research practice because it's related to the nature of research itself. It is conducted, we conduct research to test a hypothesis that cannot be known in advance and may or may not lead to improvement in health. Second, despite that potential benefits and burdens are predictable to some extent, it's extremely difficult, if not impossible, to accurately assess and qualify the benefit burden ratio, which is the social value, in advance. It's even more difficult for emerging technologies because we don't have, long-term data about them. The social value of each research project should be assessed in comparison with other research priorities, which is very different task and difficult task and requires robust and justified mechanism for research priority setting at various levels, including the policymaking level. Because social value of a research is relative to the other competing research projects that potentially could be funded, that could be supported within the limited low and middle income countries research environments regarding finance and funding. 4, the process of translating research results into health improvements is complex and often dependent on the diverse players, including industries, supply chains, upscale production, and healthcare systems and insurance companies to uptake the resulting technologies. So it's often impossible to make changes based on the results of a single research project. The 5th point is about the social value of earlier stage research studies, such as preclinical studies or basic research that can only be assessed based on the information they generate to inform further research that may cumulatively change healthcare. Consequently, the determination of social value for such earlier stage studies is always even more difficult and requiring judgment about the usefulness of a sequence of research activities. Again, this requires more expertise in assessment of social value of research. And also the involved players such as research institutions, policymakers, and research ethics committees may have limited capacity to undertake detailed assessment of social value. Exactly because of this very difficult task, the World Health Organization recently published a guidance on the ethics of health priority setting. The guideline, very interestingly, includes an annex on operationalizing social value assessment. It provides some technical points to help the World Health Organization member states understand and assess the social value of research. For WHO, the main aspect of health research priority setting is the social value. And if you open this guidance and look at it, you can see the content is mainly about the social value of research. The social value of research is always a dilemma in research and innovation priority setting because there are valid concerns related to wider technological gap in future. As you can see, on one hand, low and middle income countries face numerous immediate and pressing social needs and research priorities on one hand. And on the other hand, they fear the long-term consequences of widening technological gap, which may place their countries even further behind the technological improvements and developments, which makes it very difficult to justify mobilizing substantial resources to new technologies for them. At the same time, they have the fear of being behind. As LMICs are less likely to translate investments in emerging technology into commercially viable products, the ethical justification for mobilizing scarce public resources becomes even more complex. And in the absence of such realistic provisions, the limited investments made by LMICs often benefits developers and researchers in high-income countries. Finally, they are the winner of such investments because they are those who can translate these results to clinical benefits and commercialize them. And because they have good IP mechanisms, they can just secure their IP rights and sell them in the global markets using that IPs. So LMICs are vulnerable to exploitation in international research because of various reasons, very similar to their vulnerabilities and limited capacities. Because they have limited assessment capacity, they have low purchasing power, they have weak healthcare uptake. A weak healthcare system may be unable to uptake new technologies resulting from health even when they are provided free of charge. This is interesting. Sometimes, for example, we have a recent example of malaria vaccine developed by some international companies. And few African countries contributed to clinical trials, resulted in that vaccine development. And the vaccines were supposed to provide it freely to those countries. But the problem was those countries didn't have, health system that uptake that vaccine because sometimes vaccine needs, cold supply chains, cold chains, and, you need a health system finally to deliver something to people in remote areas. if you don't have that, and in the case of like malaria vaccine, it was really shocking that those communities that contribute to development of that vaccine, they couldn't benefit from that as other countries. So it makes a big dilemma in this case. Unlimited public involvement is another issue because, we talk about procedural justice, inclusion, participation of stakeholders, people, but these mechanisms are weak in those countries. Weak translation infrastructures, weak oversight system, like research ethics committees, again, they don't have capacity to, do a thorough assessment of international research proposals. Again, power imbalance, non-democratic or quasi-democratic structures may intensify vulnerability through unjustified power dynamics and limited safeguards such as free journalism and misaligned incentives, which is an important issue because sometimes well-connected researchers or institutions may prioritize funding, prestige, or publications over the broader social value of research. In low and middle income countries, those who work with high income countries publish in high impact journals because they are the member of that team. So these are very important incentives for people. They can use this publication, the citations for many purposes, reputation. They could easily be translated to other benefits, even receiving permission for migration. We can speak about that. But these things benefit a very limited of people in that context. And this could be an incentive, a kind of conflict of interest for them to just ignore the broader social issues. Limited capacities makes low and middle income countries vulnerable to ethics dumping or to parasitic or parachute research. Ethics dumping refers to the exploitation of research practices that would not be ethically or legally permitted in the researcher's own country. And you can easily understand the parasitic and parachute research, which means that refers to external researchers team, internal low and middle income country only long enough to collect data or samples and conduct studies with minimal local engagement and capacity building. This happened in Zika, this happened in Ebola. We don't have good examples for this for high tech like neurotechnology, but we have a good example for ethics dumping for neuroscience, which a British neuroscientist brought the animal research to Kenya because it was possible to be done in Kenya. And I'm not surprised because after a newspaper reported this, the Kenyan institution just supported that, animal study. And so when I'm talking about the power imbalance, about potential local conflict of interest of the investigators, I'm not surprised if they fully supported that ethics dumping in the destination country, not only in the departure country. So about the questionable dynamics in research sector in low and middle income countries, I found an extremely important, I think, and very good paper, which is one of the very rare data about those internal dynamics in internationally funded research setting in Africa. The paper uses a concept of unknown knowns and public secrets, things that everyone knows, but they try to keep those things as a secret. So we have unfair power dynamics and unfair relationships within the big centers established by the support of high-income countries in low and middle-income countries. These centers usually link local scientific institution to a scientific institution in high-income countries. I really suggest looking at this paper. Another important issue for risk for risk to social value of research for low and middle income countries is field migration or internal migration and international migration of researchers. International support to research initiatives in emerging technologies usually attracts highly skilled researchers and triggered a form of internal field migration because they are better paid in those institutions. And the paper that I mentioned just compares the level of incomes between those researchers who are internationally recruited and those are on local contracts. It's a big difference. So the international migration to high-income countries would be the next step. And it's not only because of the self-interest of the researchers. It becomes unavoidable in a natural research trajectory as the researchers reach the limits of what the low resource settings can support. They have no, if they want to continue as academics, continue their academic career, they have to migrate. So it's a matter of, human rights and rights to migration and rights to, international mobilization. But we need to be mindful about those impacts on those low and middle income countries when we initiate this, and we need to find ways to mitigate those risks for contributing countries. Also, there are some concerns about dual use of high-tech technologies in some low and middle income countries. Some people talk about neuropolitics or talk about the need for a tamed neurotechnology because various authorities would be able to use this technology for, control the population, manipulate population, social different levels of, paternalistic or controls, other kind of controls on civil liberties, on privacy, on human rights. So this is another issue that we should be mindful about. There are calls for actions against dual use, misuse, and malicious use of these technologies. There are reports published by Baker Institute or the reports in Financial Times about some of this kind of considerations. And the final point is about the innovation tourism. Innovation tourism is related to our understanding of new technologies. Even when such technologies eventually reach low and middle income countries' markets, they can become a form of innovative tourism. Medical innovation tourism can pose significant risk to the destination countries, which in fields such as stem cell research are often LMICs, such as Mexico, India, Thailand. A research report in World Magazine in Philippines illustrates the rise of neurotechnology-based health tourism with luxury wellness resorts offering interventions such as brain monitoring, wearables to international clients. These risks include reduced access to healthcare for local citizens due to internal and external migration of healthcare workers, division of clinical resources towards foreign patients, and the strain on already fragile health system. Moreover, when local regulatory frameworks are weak or underdeveloped, unsafe or unproven products may be offered, placing medical travelers at a substantial risk of harm. In conclusion, I think North-South research collaboration and social value is a significantly important in those kind of collaborations. North-South research collaboration, particularly in high-tech fields such as neurotechnology, is highly complex and should be undertaken with careful attention to structural realities, power imbalances, and context-specific vulnerabilities. This is specifically important when assessing the social value of research for all contributing societies and when ensuring that benefits, burdens, and risk are distributed fairly. And as I declared, I used ChatGPT for creating those images. I was not so expert in that. It took some time to be able to create good pictures. And there's references that you can see. And this is a picture from a mosque in Shiraz, a city in southern Iran where I studied medicine many years ago. It's Nasirul Mulk Mosque. And in specific times of each day, it would be, I think, the best place on the world. Thank you so much.